my name is Jessica Eddington, and I am here at Midland Dermatology with Dr. Russell Akin, who is a board-certified dermatologist and fellowship-trained Mohs surgeon. And May is Melanoma Awareness Month, so we are going to answer some frequently asked questions regarding melanoma. So the first question I have for Dr. Akin is, what is melanoma and how is it different from other forms of skin cancer?
So melanoma-type skin cancer is a skin cancer that originates from normal melanocytes, and when those types of cells begin to go out of control, that's when melanoma is diagnosed, or that's what causes melanoma. And so melanoma skin cancer is associated with really two factors that I think of when I think of melanoma, and one is skin type, and the other thing is ultraviolet exposure. And so outside of a few genetic and inherited syndromes where patients are at increased risk for melanoma, the biggest two factors are really skin type, or how much protective melanin that you have in your skin, and also sun exposure over time. And so when we think about skin type, people that have some pigment in their skin are much less likely to develop skin cancer than really fair complected folks. And when I think fair complexion, I think blonde hair, blue eyes, and then orange hair and really fair skin. So there's two types of melanin, pheomelanin and melanin. Pheomelanin is not very protective at all when it comes to preventing or avoiding ultraviolet DNA damage at the cellular level. And then there's melanin. What melanin does in the skin is it really reflects or refracts the light so that there's not cellular damage that occurs within the cells. And so that's what ultraviolet light does over time, whether it's ultraviolet light exposure from outdoor exposure or much more increased intensity light with tanning beds, is it causes a change in the DNA structures within the skin cells that then predispose you to developing a skin cancer. And so when we think of skin cancer, we think about the three most common types of skin cancers, and there are other types of skin cancers that are less common, but basal cell, squamous cell, and melanoma. Melanoma only makes up about 10% of skin cancers, but it's the most deadly of those three most common types of skin cancer.
Mm-hmm. Okay. My second question, how long does it take for melanoma to show up on average? For example, if I damage my skin this summer from a sunburn, would melanoma typically take about a few years to appear?
So when I think of melanoma, I think of really sun-damaged melanoma, which produces what's called lentigo maligna or lentigo maligna melanoma, and those types of skin cancers usually occur in 50, 60, 70, 80-year-old individuals, or superficial spreading melanoma, which is the type of melanoma that we see in younger people, and so 20, 30s, and 40 years of age. And so superficial spreading melanoma is much more likely to develop from one bad sunburn or several bad sunburns in childhood, whereas lentigo maligna melanoma is more related to lifetime sun exposure.
Okay.
And so as far as quantifying how long after a sunburn does that occur, it can occur from anywhere from several years to tens of years or decades later. But superficial spreading melanoma, and that's the tragedy with melanoma, is melanoma can affect otherwise completely healthy individuals and young individuals, and some types of melanomas are much more likely to metastasize early than others. And so that's the tragedy with melanoma skin cancer, is that it does affect young patients. There's about 10,000 people a year that die from melanoma-type skin cancer. The treatments that we have available for melanoma are much better than they were even 5, 6, 7 years ago. And really, the reason for that is because of sequencing of the genome. We begin to understand the genetics associated with melanoma and what the interplay is between cells and medications and treatment, and what causes melanoma to develop. And as a result, it's resulted in targeted therapies. And so we actually have medications now that will prolong life, where 5 to 10 years ago we didn't have those available.
That's awesome. Okay, my third question is, what does melanoma typically look like? For example, how would someone best differentiate age spots, warts, etc. from melanoma or other forms of skin cancer?
Okay. So melanoma, about 70% of melanoma skin cancer just pops up and starts growing. 30% comes from a pre-existing mole or a mole that changes over time. And so it's important to look yourself over. It's important to know what's on your skin and on your body. And if there's anything that's growing or changing that looks abnormal, then it needs to be checked. But in general, criteria that we utilize that's easy in screening is A, B, C, D, E of melanoma. And so asymmetry, if you divide a mole in half and one side looks different than the other, then it probably needs to be checked out. Borders that are irregular or notched. And so if you have a mole that is normal in appearance and nice and oval or circle and begins to look like a Mickey Mouse hat, it's abnormal and the borders are irregular and it needs to be checked. Color variation, red, white, blue, black, and brown are all colors that we can see in melanoma. So most melanomas are brown or pigmented lesions, but we can see red, white, and blue also within melanoma. Diameter, most melanomas are larger in diameter, and so larger than the size of a pencil eraser, which is about 6 millimeters in size, or anything that's growing or changing over time. Occasionally we'll see a 2 or 3 millimeter melanoma, which is a very small lesion, but as a rule of thumb, most melanomas tend to be a little bit larger lesions.
Okay, it's really helpful. The next question, can melanoma be caused from burning your skin on extremely hot surfaces such as a stove, or is it typically only from the sun?
Most commonly from the sun. Ultraviolet exposure causes a change in the DNA structure of the cells, but there's more to it than just that. In particular, not just with melanoma skin cancer, but also with basal cell and squamous cells. I've had several patients come in that say, I injured myself and I developed this spot that just wouldn't heal. And so personally, I think that once that there's a genetic alteration that occurs in the normal skin cells, then anything from trauma to repeated sun exposure can cause those cells to begin to grow out of control and can cause a skin cancer, but definitely more common with ultraviolet radiation.
Okay. Next question, why does melanoma spread so quickly? Is there a certain area of the body that melanoma typically spreads to, or is it random?
Okay. So the key thing with melanoma is if melanoma is diagnosed early, then it's a very treatable type of skin cancer, and so it's very early. It's very important to get assistance early and to get treated early if there's a spot that is worrisome. And so when we see problems with melanoma, it's either a spot that in a patient that didn't know what it was, or a lesion that was ignored or just wasn't checked out, outside of nodular melanoma, which tends to be just a deeper type of melanoma with an increased risk of spreading early. Melanoma, when it does metastasize, usually goes to non-skin sites, and so most commonly it will either go to lung, brain, or liver after going to the regional lymph nodes. And once it goes to other organ systems, and those are the most common organ systems that it goes to, but most melanomas will metastasize to the regional lymph nodes before they go other places. And so in general, for deeper melanomas, any melanoma that's deeper than 0.75 to 1 millimeters in depth, then we'll usually recommend a sentinel lymph node biopsy to see if there's anything that has metastasized to the regional lymph node basin that has the risk of going other places.
Okay. And the next question, can basal cell or squamous cell carcinoma develop into melanoma if left untreated?
Absolutely not. So basal cells are basal cells, squamous cells are squamous cells. They're derived from different cells within the skin, and melanoma comes from a completely different cell line or lineage than basal or squamous cells, and so one doesn't turn into the other. But statistically, once you've had one skin cancer, you're at a higher risk for developing other types of skin cancers.
Yeah.
So,
good deal. So next question is, okay, so how do you typically diagnose melanoma and how do you treat it?
So melanoma is usually diagnosed with a suspicion based on what it looks like. We also use dermoscopy, which is polarized light. Melanoma has a particular architecture with dermoscopy that's different than most normal moles or nevi. And then really the workhorse of diagnosis is a skin biopsy, whether that's just a simple in-office shade biopsy, punch biopsy, or excisional biopsy, based on suspicious lesion. But looking under the microscope is primarily the gold standard for diagnosing melanoma.
Okay. And next question, how can someone prevent from being diagnosed with melanoma?
So protect yourself, and not only protect yourself, but get kids and grandkids in the habit of wearing sun protective clothing and wearing sunscreen, and just developing lifelong sun safe practices. even dermatologist. I didn't know that I was going to be a dermatologist when I was 17, 18 years old. And so I think that primarily, just like, practicing safe habits in life otherwise, is we need to teach young people to practice safe sun habits as they grow older and help to avoid the long-term effects of ultraviolet radiation, sun exposure, and increase the risk over their lifetime of skin cancer. Definitely, if you have a first-degree relative with melanoma, then you're statistically at higher risk of developing melanoma. We can also see melanoma at other anatomic sites, not just the skin. Melanoma can occur in the back of the eye, it can occur in females vaginally, and so other locations that aren't commonly thought of are areas that we can see melanoma as well.
Okay, those are all the questions I have today about melanoma. If you guys want to schedule an appointment with Dr. Akin or any of the providers here at Midland Dermatology, you can call 432-689-2512. Thank you.